Using the right mobility aid can reduce the risk of falling, reduce pain, compensate for neurological impairment, and improve confidence. Unfortunately, some of these aids are acquired through informal sources without seeking advice from a health professional. As a general rule, the larger the mobility aid, the more stable it becomes. However, the trade-off is walking speed and access to different environments, which is often reduced. Pickup frames, also referred to as Zimmer, static or hopper frames, have 4 legs and 3 sides. The height of the frame can be fixed or adjustable. The legs of these frames have rubber tips to reduce the risk of slippage. Some models have 2 wheels at the front or 2 skis on the rear legs. 2-wheeled frames are often called modified pickup frames or rollator frames. Unlike the wheels of the 4-wheeled walkers, which can rotate, these wheels are fixed, which increases stability. Most frames can fold down for easy transportation. However, fixed frames are often stronger and can have a higher weight limit. People often use pickup frames when they've reduced confidence and reduced balance. They are designed for people who can stand with light support but require additional support when walking. Frames are also commonly used for people with reduced weight bearing through one leg who require more support than crutches. Due to the stop-start nature of these frames, people using these frames expend more energy. Therefore, these frames are more suitable for indoor use and shorter distances. Frames with small wheels can be more difficult to move on carpet. Fitting the rear legs with skis instead of stoppers on the back can be advantageous. The person using a pickup frame should wear the appropriate footwear, stand in an upright position with shoulders relaxed and arms by their side. The elbows should not have more than 10 to 20 degrees bend. The handles of the frame should be at the height of the wrist crease. Lift or push the frame forward about 1 step length without overstretching. Make sure all 4 rubber tips are firmly on the ground before stepping. Take 2 steps starting with the weaker leg, leaning through the arms for increased support. Frames without wheels produce more of a halting pattern. Wheeled frames produce a more normal walking pattern and require less energy to lift the frame. Ensure the frame has been fully unfolded if recently transported or in a folded position. Do not pull on the frame to stand or sit, as the frame can tip over. Avoid leaning too close to the front or side, which may cause the user to overbalance. If using a frame without wheels, do not lift the frame and move your feet at the same time. Mobility equipment must be inspected for signs of wear and tear. Always check for signs of bending, deformity, breakage or corrosion. Protruding or missing screws, split or loose hand grips, worn rubber tips, the safe user weight limit sticker. Always wear well-fitting footwear with non-slip soles. No thongs, loose slippers or socks. When outdoors, take care on wet or uneven surfaces. Frames should not be used on stairs. When prescribing a mobility aid in the home, check for and eliminate any trip hazards such as loose rugs, power cords or cluttered furniture. If the person using the mobility aid has stronger leg strength in one leg, turn toward the stronger side to provide more support. Where possible, these aids should all be prescribed by a trained health professional, such as a physiotherapist or occupational therapist. For more information, contact your local hospital physiotherapy department. Other options in the community may include private providers, local pharmacies, or local health equipment suppliers.